First, we want to talk about the anatomy of the venous system, specifically the drainage of the veins of the head, neck, and upper limbs into the heart. As you know, there are two main vessels that enter the ventricle. That is, they enter the right atrium, and from the right atrium enter the right ventricle. One is the superior vena cava, and the other is the inferior vena cava. The inferior vena cava brings blood from the lower limbs and the lower parts of the body and delivers it to the right side of the heart. The SVC, or superior vena cava, brings blood from the upper limbs, and as it ascends, it divides into two main branches, the left brachiocephalic and the right brachiocephalic. Each of these brachiocephalics further divides into two main branches, the internal jugular vein and the subclavian vein. The subclavian vein goes into the arms. The internal jugular vein enters the neck. Venous blood from the head, neck, and limbs enters the right atrium through the SVC. From the right atrium, it moves into the right ventricle, and the right ventricle pumps the blood into the pulmonary artery, which ultimately carries it to the lungs. After being oxygenated there, the blood returns and enters the left side of the heart. What is the significance of JVP? The importance of JVP is that it serves as an indicator of changes in pressure and volume on the right side of the heart, especially the right atrium. JVP is very easily visible in the neck, and based on its changes, we can infer what is happening on the right side of the heart. We have two jugular veins. In the neck, there are the internal jugular vein and the external jugular vein. The external jugular vein is more superficial and is located on top of the sternocleidomastoid muscle. As you know, there is a muscle in the neck called the SCM, or sternocleidomastoid muscle. One end of it is attached to the mastoid bone, which is located behind the ear, and its lower part splits into two branches. One branch attaches to the clavicle bone, and the other branch attaches to the sternum or manubrium. The lower part of the internal jugular vein is located almost between the two heads of the SCM muscle, passes underneath the muscle, and runs parallel to it, connecting to the neck. Therefore, this is the internal jugular vein. The external jugular vein is more superficial and passes over the SCM muscle or sternocleidomastoid, crossing it. So this is indeed the external jugular vein, a very important vessel. We use the internal jugular vein to assess JVP. Why? For three reasons. First, because the internal jugular vein has a larger diameter. Second, it has a more direct path. And third, it has no valves, meaning it is valveless. That's why it reflects the pressure and volume changes of the right side of the heart much better and more directly compared to the external jugular vein.